Gender-based violence, GBV, is one of the driving forces of the HIV and AIDS epidemic worldwide. Gender-based violence, defined as any form of violence directed towards an individual or a group on the basis of their gender, illustrates more than any issue how gender shapes HIV vulnerability. Hello and welcome to another episode of The Last Mile with NACA. I am Ade Suwasui. Gender-based violence can directly and indirectly lead to HIV infection. Sexual violence is the most direct link between gender-based violence and HIV, as trauma increases the risk of transmission. Stay with us for more on this.
Gender-based violence, or GBV, one of the most widespread but least recognized human rights abuses in the world, is one of the driving forces of the HIV and AIDS epidemic, affecting individuals and communities everywhere. Many victims of gender-based violence have less self-esteem and a lowered sense to self-worth. As a result, it is much harder to coax people who face GBV or who fear violence or abandonment to seek services, test for HIV, or to successfully access or adhere to treatment.
Gender-based violence, we know it's any form of violation directed at anyone as a result of his gender. So it comes in various forms. It could be physical, it could be emotional, it could be psychological. In situation of rape, you don't know the status of HIV status of the rapist, and in so many instances, some of them are positive. And we know when they are living with HIV, it will impact on how they take their treatment, whether they even want to accept that condition and live positively with it. Eat healthily, take their medication. So there's so much relationship between gender-based violence and HIV transmission.
Violence from partners and family members following disclosure of HIV-positive status, inability to negotiate safer sex due to violence or threats of violence are some examples of the dual global epidemics of HIV and AIDS and gender-based violence.
We also see it in terms of maltreatment of people living with HIV, especially most of the time women, particularly in situation of transmission to child, what we call vertical transmission of HIV, where it's the woman who goes to the hospital, get tested, and is first known. It's not that you don't know who. Of course, she probably gets it from someone, maybe the spouse or the partner. And you see the woman, because she's the one that is tested and positive, becomes the carrier, becomes the person that has brought the virus and disease to the family. We also have it in form of economic abuse, where people, because they are not empowered, they do not have economic power, they cannot negotiate safe sex, they cannot, even where they know their partner is not, they can't trust, they are unable to discuss it. They also at times need to pick up sex work, which can predispose them to HIV transmission. So we have a lot of issues that we deal with that we must address in order to actually have HIV controlled and bring the epidemic to a closure.
The 16 Days of Activism Against Gender-Based Violence, an annual international campaign, is one of the platforms used by the National Agency for the Control of AIDS, NACA, to raise awareness on the menace.
In terms of prevention of HIV, as we have 16 days of activism to eliminate gender-based violence, and it's also a period, a season where we talk about HIV and human rights. These are very related issues that we need to raise awareness. We have to eliminate gender-based violence for us to actually eliminate and AIDS and HIV transmission control epidemic, because we see, especially within the time of lockdown, a lot of women were abused. Even we have young girls, even boys, having sexual abuse. And sexual abuse, like I already established, is there's strong relationship with the transmission of the virus. So they are very related, and that's why we're raising awareness that everyone must come out to work at ending violence, any form of violence, particularly gender-based violence.
To address economic GBV, NACA carried out several capacity building and empowerment programs across the country aimed at strengthening self-efficacy and decision-making power of vulnerable groups and key populations.
In packaging our programs, we develop interventions for indigent, disempowered individuals, especially women, even our men who do not have skills to make good living, with soft skills and also start-off funds to be able to start making, at least have means of livelihood. When they have means of livelihood, it will reduce the risk of HIV. So it's a way of preventing HIV transmission. And for those who are positive, when they are on medication, they need healthy living, they need good food, they need to even be able to afford the resources to get to the facilities to pick up the drugs. So some facilities, they need to pay stipend in terms of management of the services being provided by the facilities. And it's been working well. We have partners who have supported us, especially during the COVID lockdown, as part of effort to palliative support. We have the EU-UN Joint Basket Fund, the project we ran with a network of people living with HIV and AIDS in 15 states. We have about 10,000 indigent persons who have benefited and getting direct funds from this project. And then we also give them some personal protective equipment and education around gender-based violence, HIV, and COVID-19. We also have the government resources coming for empowerment. We even have some of the legislators' constituency projects they're doing to empower individuals using this strategy. So it's been successful, and is one of the strategies to help us bring the HIV epidemic under control.
There are several policies and laws put in place by the government of Nigeria to tackle gender-based violence.
There's the HIV/AIDS Anti-Discrimination Act of 2014, and I think 18 states have domesticated it. Of course, it's operative in FCT. So the law provides that you do not discriminate against anyone based on their real or perceived HIV status. So if that is done, there are provisions of what should happen. You should, if you get to court, what penalty we should get. And we have a number of cases. People call our toll-free line 6222 to report, and we have a number of cases that have been resolved, working closely with National Human Rights Commission. We also work with our sister institution managing, that's NAPTIP, and also a lot of platforms by civil society organization. Apart from stigma and the 2014 HIV Stigma and Discrimination Act, we also have the 2015 Violence Against Persons Prohibition Act that is operative, that is also used to support and to address violation in the area. We also have Administration of Criminal Justice Acts, because there are a number of conditions where people are abused, raped, young children raped, that the processes would not allow quick access to justice. But with the AJA, there is a speedy dispensation of justice.
If you experience gender-based violence based on your perceived or actual HIV status, call NACA on 6222 for help.
The first thing you need to do in the situation of abuse is get a medical confirmation, a medical test from as soon as the event occurs, because there must be evidence. We also work with the police, with the law enforcement institutions. The police, they have gender desk, and we can call and link up across the country. We work with Police Action Committee closely, and we are building capacity so that people are able to deal with some of these issues. But the most critical thing is when it happens, call our toll-free line 6222, report, and you get appropriate care. A lot of people are calling, and they are getting linked to services by our partners, also by civil society organizations that are responding within the community.
The rise of GBV in Nigeria, if not curbed, poses significant social and economic repercussions, with life-threatening consequences and profound impact, not just for the survivor, but also for communities and the country at large.
What we want people to know is that there is an act against HIV stigma and discrimination. And the act has two components. There is the jail component, there is the fine component of it. So it can be both, actually, depending on the gravity. People with HIV live normal life. They work as productive as any member of the community. And among them are intelligent people, hardworking people. Why should we discriminate against them? If we stigmatize people and we discriminate, it puts them away from our hospitals. It prevents them from coming to our facility to know their status. It prevents them from coming to our facilities to take these medications that are very helpful. So stigma is a number one enemy for us in fighting HIV disease and in controlling HIV disease. And we will be all out against it.
Hello?
Hello, babe, what's up? How is Valentine with me now? You know I love you.
Love no be for mouth. Now by action.
You have to show it. First to yourself and then to others. So show love this Valentine's season by getting tested.
Know your HIV status. It is free in every government hospital. I beg, I'm gonna try whole body. But if you no fit, practice safe sex. Protect yourself and others.
And finally, love is the best treatment to heal the pain and stigma of people living with HIV.
Helping us achieve a country free of HIV is the greatest show of love to our fellow Nigerians. Spread love, not HIV. Happy Valentine's Day.
The update segment brings you a highlight of NACA's activities across the country and abroad. Keep watching.
In line with one of its mandates, which is to formulate policies and guidelines on HIV and AIDS, the National Agency for the Control of AIDS, NACA, recently launched the National HIV Self-Testing and Pre-Exposure Prophylaxis Communication Strategy document in Abuja. Developed with support from the U.S. President's Emergency Plan for AIDS Relief, PEPFAR, USAID, Heartland Alliance, John Snow Incorporated, and other implementing partners, the document aims to address the communication gaps in the demand and uptake of HIV self-test kits and pre-exposure prophylaxis drugs. The welcome remark was delivered by Alex Ogundipe, Director of Community Prevention and Care Service, NACA.
It has been a long journey to come this far. We've traveled across the country. We've taken opinions. We've had experts. We've spent resources. And it's taken us a long time. And we're very, very proud of what's the product that we have before you today to be released for the use of all stakeholders, particularly public health, NGOs, and everyone that needs to communicate the availability of these fantastic interventions within the national response.
Goodwill messages were delivered by the Chiefs of Party, Jon Snow Inc., Heartland Alliance and FHI 360 EPIC, the Director, HIV and TB Office, USAID, the Project Manager, Federal Capital Territory Agency for the Control of HIV and AIDS.
I want to start by congratulating the Director General of NACA and the entire Community Prevention and SBCC team of NACA on the successful completion of the development of this strategy. This is a strategy that has taken about 2 years to develop, working with Heartland Alliance and other implementing partners in Nigeria under the support and generosity of USAID. We're able to work with stakeholders across the country to have this document developed. At this point, I also want to appreciate the input of Dr. Funke Oki, Mr. Alex Ogundipe, Dr. Daniel Udwak, and a lot of other people that played a strong role in the development of this document. Once again, I want to congratulate NACA, and I wish we have a fruitful deliberation.
It's a great pleasure for us at Heartland Alliance, with the support of USAID, to be able to contribute to this very important milestone in the HIV response in the country. As you all know, we are all working towards epidemic control, but beyond epidemic control, we need to think of what happens thereafter. So these strategies we are putting in place, self-testing, pre-exposure prophylaxis, is going to help us even beyond the 2030 target that we put together. So it's a great honor for us, and I wish that we don't only put this together, but we are able to take the next step, which is actually disseminating and ensuring implementation, tracking, learning lessons from it, and getting back to the drawing board so that we achieve the aim of this effort.
I want to congratulate Nigeria today, especially NACA, for leading this process. And this is a very rich document which will help us to further define the landscape for HIV/ST, self-testing, and also for PrEP in Nigeria. Communication is key, and I'm very excited that this long journey has come.
Self-testing and PrEP are two relatively new, let's say, advances that really can empower an individual who might otherwise be in their lives somehow disempowered, whether it's due to stigma, whether it's due to access in facilities. These two strategies can really help people take their own lives and their own destinies into their hands. So these new technologies, I think Nigeria's done an excellent job of embracing them. And I think what's exciting is that we are seeing implementation.
On behalf of my colleagues, we at Subnational, we are very excited with the launching of this very important document, starting it with the new year, January. We are very grateful for NACA and all those who has put in their resources in ensuring that these documents are available. I'm also appealing that these documents should also go around to my colleagues, to everyone at Subnational, to be able to fast-track our epidemic control. Once again, I want to congratulate DG NACA and others for this very, very important document at this moment.
In his remarks, the Director General, NACA, Dr. Gambo Aliyu, explained that the document is crucial if Nigeria is to achieve 90% reduction of new infections by 2025.
The document guiding HIV self-testing was first published by WHO in 2016. This document was domesticated by Nigeria in 2018. And now, as we ratchet up activities, as we've done with treatment, we're scaling up activities also to improve prevention because this is critical for us drastically reducing new infection by 90% by the year 2025, it is imperative that we launch this document, and it is imperative that we have these guidelines guiding HIV self-testing as well as PrEP implementation. I'm delighted to notice that as we are launching this document, already between 173 to 174,000 people have already initiated on PrEP nationwide. This is encouraging.
The National HIV Self-Testing and Pre-Exposure Prophylaxis Communication Strategy is designed to facilitate effective communication, which is key in ensuring optimum access of preventive services.
A major challenge facing HIV control in Nigeria is the growing number of people living with the virus but are yet to learn about their HIV status due to fear of stigma and discrimination. HIV self-test kit is a simple, effective, and quicker way of learning about your HIV status in the privacy of your home. The test can be performed using saliva by rubbing the outer part of your upper gum, followed by the outer part of your lower gum with a flat pad, and then dipping the flat pad into a buffer tube to wait for 20 minutes for the result to read. For more information, contact our call center at 6222 or NACA's website. Our services are available to you Monday to Friday every week.
Like this now, take am easy now.
Na hospital I dey go to do HIV test.
Na everything you dey do HIV test. Before you carry belle, you do HIV test. Now you dey rush go do another HIV test. Wetin you dey find, you go see am o.
No be so, my sister. HIV test no be bad thing o. Na make I know my status so that no matter the result, my pikin no go get HIV.
HIV fit pass from mama to pikin?
Yes o, during pregnancy or labour, or even when we dey breastfeed the pikin. Yes, and my husband dey road dey come sef, he go meet me for hospital. We go do the test together.
Hey, your husband na man he be. But wait o, una no dey fear. What if the result come out positive?
Fear wetin na? HIV no be death sen ten ce, and medicine don dey to take manage am. See, nowadays people wey get HIV dey live their life normal like everybody else.
You sure say I no go follow you go do my own so?
Wetin you dey wait for now? Come make we go jare. With quick action, we fit stop this HIV waka from mama to pikin. Go do your own HIV test today.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng. Thanks for watching, and as always, continue to support the HIV response. Say no to gender-based violence. Do not discriminate or stigmatize people living with HIV. Avoid indiscriminate sex. And lastly, know your status and take action. Till next week on The Last Mile with NACA, I am Adesuwa Osu. Goodbye.